Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soule.
And welcome to Community Conversations. You know, every week I come on board and I think, what am I going to say? What am I going to rave about this week? Because we always have the best guests. And today is no different. I've been able to recruit someone who hasn't been on my show before, but is very, very good at what she does. And that would be Tina, our famous Tina. Tina's been in the community for a long time. We kind of recruited her to Treasure Coast Community Health, but she comes with lots of good credentials in the community. She is bilingual, and she does wonderful things to help educate our community. And today she's going to talk about quitting smoking.
Yes, ma'am.
So you may not be a smoker. Don't reach for the dial. She has lots of good information that you might want to talk about with your friends, your family, and other people that you come into contact with. Now, Tina, you recently got a certification, didn't you?
Actually, I'm in the process of getting a certification. I'm so excited about it. It's been quite a while that I had to wait, but I'm ready.
COVID has really postponed a lot of plans, hasn't it?
Yes, you're right. So, but I'm ready to finish the course. It's a very long course, but I'm ready to.
So, how long have you been doing the quit smoking, smoking cessation classes?
Very long time. I would say 15 to 16 years.
Wow, you've probably heard it all then, haven't you?
Yes.
I'll bet you start a lot of different sessions with, I didn't really want to quit. I don't think I can quit, but my wife, husband, spouse, father, mother, children said, you need to come.
Absolutely, yes. And we have that a whole lot. So, but the main thing is that they're there. Mm-hmm. So we start working with that. You're here, so it's a hard process. It is. It
is because it's both physically challenging as well as emotionally.
Absolutely.
So do you talk about those things?
Yes, we do all the time because that is so intricate and the process of quitting. Smoking has been so embedded in a person. Mm-hmm. And I was a smoker, and I really enjoyed it. A lot of us. And we have to go and ask because most of us love to smoke. So that's something that we do talk about it, and because it's a process of self-discovery kind of deal. What are you going to do instead of your best friend? Smoking is such a huge part of a person's.
You can be at a party that has a no smoking policy at the restaurant or whatever, and so you and your best friend go outside for a while, right?
And we feel comfortable and like it and enjoy it. Yeah.
So these stop smoking classes have been going on for a while. How has COVID changed that, or has it?
Oh, a whole lot. Yes. Yeah. First of all, we had to go online, and we do still have online classes. But for me, I like the connection, the people. Yeah. Oh, yes, absolutely. So, and we've been having classes, not too big, but yes, we continue to.
And who's
to
hosting those classes?
I am.
I'm at your home? I'll be there.
No, we do. The county has been extremely generous and very supportive of this classes since day one. So they host us, and they allow us to use one of their conference rooms at the county.
At the county building?
Yes.
So it's nice and central in Vero.
Yes, it is. Yes.
Nothing up in Sebastian physically?
We used to, but I don't think our facilitator there is offering those classes anymore. The hospital, the Indian River Cleveland Clinic does have those. But again, because of COVID, we had to
make some adjustments.
And go to the county for now. Okay. So,
But you mentioned online classes as well.
Yes.
So these aren't blended. There's like an online and there's a physical class.
Yes, they're separate. Yes.
Okay.
and we do have a 4-week class, a 1 hour class weekly, and then we have a 2-hour class. Kind of sums it up all the 4 classes.
Okay.
So they're a continuation.
Do you give them homework too in between the
yes,
classes?
We do. Yes, we do. And
I expected you to say no, but that's an idea.
No, we do. And as a matter of fact, we just changed the book that we use. I love it because it's a workbook. And for me, it's like I have to write, make me think. And I think that most of our participants like that too, because that's what it is kind of creating a plan that is going to work for you, because we have so many tools for them, but we put them on the table and they're going to pick what is best for them. So it's just...
So tell me about some of the tools. Are these like the patches? The
patches,
smoking?
yes.
The nicotine aids?
This class provide free patches, free gum, or lozenges is the participant's choice. And so the approach is a 3-prong. I always like to think like that.
Okay.
The patches, the gum, or the lozenges, your preference, and then the behavior modification, which is the hardest, we think. Because and
like just because you get the urge to leave the party, you have to clench your feet and not do that with your best friend.
So you have to kind of change gears there, and that's part of what we do. A lot of times we spend a lot of time, because it's kind of pushing the person out of their comfort zone. And that's hard, especially if you've been smoking for so many years.
And a lot of people start really young.
Yes.
And
so we have those a lot. Yeah.
Do you?
Yeah, we do.
I'm going to ask,
yes,
are your classes mostly women, or a nice mix of men and women at any given time?
Lately, we've had a lot of guys come in to the classes, but it's a good mix. And sometimes it's more women, just a group of women, but we've had everything. And
I've read a couple of studies, and they do say that boys tend to start smoking sooner than the gals.
Yes. Even though I started at 13. So that's, I know.
Whoa, I'm going to have to check out my teens a little bit closer.
But in Notre County, we had a decrease in teen. The Department of Health has the SWAT clubs at all elementary,
middle schools?
Middle schools. So that has created like a good for the kids to be so active, especially with the city councils, the county commissioners. So they're very involved in changing laws and policies. So that's why we like it. Yes.
And then they even, I remember pre-COVID, were working to educate people that didn't have children, although it's not great for little kids to be around smoke, that it's also not good for their pets.
Of course not, yes.
And so, a lot of folks were like, oh, I hadn't thought of that.
Yeah, exactly. And as a matter of fact, they created a pamphlet with about smoking and your pet. So that was very exciting for them
We need to get that back up and on the road again.
Sure.
We tend to go in dips in waves. Like, let's talk about this all the time. And right now it's COVID.
I know, right?
Which is a breathing problem. So
it is.
So are you seeing people relate that to their smoking?
Yes, they do. Yes, we have. And the connection there is not very, as everything with COVID, we don't see. But it is a respiratory virus. So, of course, they tend to be more at risk and getting very sick and going to the hospital. So
because their lung capacity is already compromised by smoking, and then the virus gets in there and
it just destroys it. Yes, absolutely. And we do have COPDs coming too. And the good thing with smoking is, even though you've been smoking for a long time, when you decide to quit, immediately your body starts to regenerate.
Isn't that cool? When you think about the lungs, and there's sort of a spongy material and getting all that stuff in it.
I know.
It's a miracle to me because it's not 100%. Like you can take it and wring it out with cold water like you do a dirty sponge at home. How does our body regenerate and clean up all that stuff? Of course, amazing. I guess that's all the coughing that we hear. Exactly. Is that a common complaint? I'm tired of waking up feeling yucky.
Yes, and the smell. And now the stigma that it's not like we used to. Now you have to go all the way to the back or not having a place
in like the Marlboro Man anymore, right?
And I started smoking because I wanted to feel cool and sophisticated and all that.
Absolutely.
So, but nowadays is so with all the laws and my goodness, the taxes on this is a very
it's an expensive habit, isn't it?
Yes, it is. Goodness. It is. Yes. So, and that's our most effective way to decrease people smoking the taxes.
Talking about how much it costs them and how that money could be used otherwise.
Yes.
That is.
I'm a very visual person, so I always tell our participants, just put it in a bowl and see every week how it's. That's a very nice when we open up again a cruise or a family or a getaway, whatever. So
even Christmas presents that you couldn't otherwise afford for your best bud, right?
Yes.
So, Tina, this is fantastic, but we're going to take a short break.
Sure.
A word from our sponsors, and then we'll come back and we'll talk about other things that are going on.
Thank you.
Revolving around no more smoking.
I know, right?
Yeah.
Thank you.
Hi, I'm Vicki Soule, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not. And at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org.
Are you a therapist or a nurse seeking the multi-state compact license? In the state of Florida, these and many other industries require a Level 2 live scan background check for clearance to work in your industry. A1A Fingerprints is your certified live scan source from Broward to Brevard. And if you're a medical provider, you need to be registered on the ACA web portal. A1A Fingerprints will help you navigate and comply with the law. Call 772-494-6556 or visit a1afingerprints.com. A1A Fingerprints.
Hello, this is Carol Jean Jordan, your tax collector here in Indian River County. All of our offices are scheduling appointments for in-office services, but you can get that little yellow sticker quicker by using our Express Lane. It's fast, convenient, and free when you pay with an e-check. Renew your registration on our website and select Pick Up at the Tax Collector's Office. Order before 3 p.m. and you can pick up your little yellow sticker on the same day. Order at irctax.com. That's irctax.com.
And welcome back to Community Conversations. This is Vicki Soule. For those of you just joining us, my guest today is Tina Zayas. Tina is a almost certified smoking counselor, but she's been doing it for years and years, and we're so happy that she does, because Indian River County is at the top of many wonderful things, but they're also at the top of the smokers in this region. Our rate is a couple % higher than the statewide average. Mm-hmm. And we can't figure out why, because it's a little piece of paradise. But, as we were talking earlier, I think a lot of people start young and it just becomes a part of who they are. Okay, as you said earlier, it's like your best buddy, and you go out to have
with your buddy.
social time for whatever it takes, 30 seconds to 2 minutes. And that's a real modification to your lifestyle and who you are.
Exactly.
As you said, when you start as a teenager.
Oh boy,
you want to.
And I was a chronic smoker. I was a chain smoker.
Oh my goodness.
So for me, quitting was a nightmare. It was traumatizing, really.
And did you use the assisted?
No, I did not. And that's why I'm a huge proponent of using all these aids that are available to us, patches, gum, all of it, to help you not to go through I went through. I didn't go back to smoking because I didn't want to go through that nightmare again. So I just kept going, and that kind of saved me.
True confession.
Yes.
I was a high school smoker.
Okay. Were you a closet or?
I was the last one of our little girl clique to try it. And you're right. It's so addictive. After I decided that I was not going to do that, I can remember going up and smelling the smoke from other smokers and thinking, this is crazy.
Yes,
this is absolutely crazy. But it is so addictive.
Highly addictive. Yeah. Highly addictive.
And so these aids really have made it easier for a lot of folks.
Yes. And because of this 3-prong approach, we think that that's the combo that will help you overcome this addiction. It's just
so for those that might be slow learners like me, how many times can you take the class?
Well, as many times as you need to. The only thing is that in order for you to receive the patches, the gum, and the lozenges, you only come twice. Okay. But that's why we give you the quit line, the web page, because you can get patches and gum and lozenges through all of them.
Oh, okay.
So when you come to the class, we give you like a business card with all the names and phone numbers, so you can. It is a goal to have all these resources available to our participant and to make them aware that they're there for their benefit. So.
Well, I only asked because it was a flashback to meeting my father-in-law. He was a tax accountant, so every April 16th he'd declare, I'm going to quit smoking. And his kids would go, I roll. Yeah, Dad. And it was good for varying periods of time.
Oh, okay.
But with 7 kids, he went back to it. He said that was a stress reliever. And I'm not sure that that's so, but at that time they certainly didn't have
these. Of course, and it is a common... it
was very common. More people smoked than didn't.
Yes.
So now we're finding that a lot of folks are vaping instead, using e-cigarettes. Talk to us about that. Does this class help?
Yes, but not with the vaping. We do not, how do you say, promote or support, because for us is you're going to try to quit smoking, and what are you going to have another addiction?
Right.
So the goal of this program is to get you off of cigarettes and any tobacco-related product for good. That's the goal. Yeah. So we do not support it. The only aids that we support is the FDA approved, like the patch, the gum, the lozenges, and the other.
So are you inferring that some people come to the classes expecting you're going to recommend to wean down by using e-cigarettes?
Yes. And as a matter of fact, I have one right now.
All the information says that is much more concentrated and much more garbage in it.
And damaging, yes. But I think sometimes our participants are looking to, not
sort
to
of slide the rules a little. It's tough
and
work.
Help them with that process.
Gotcha.
And I always say, I'm not going to lie to you, it's a hard process. But the fact that they're there in the class, that says a lot. So we kind of start working on that and building up. And our books are very good. I think that the workbook kind of pushes you to kind of think about how you're going to tackle this one, because what works for me may not work for you. So it's a very personal plan. So we work on that individually, actually, and in all the classes.
Do you ever have the smokers bring a loved one with them?
Of course. And we highly recommend
it?
and yes,
Okay.
and encourage them. If you have somebody willing to come with you, you know, we've had even children come into the classes. Yes, because grandma was babysitting and say, bring them in.
And that's okay.
Yes, it's okay. Yes.
But you do have online classes as well.
We do.
So how do people register for one or the other?
We always say if you can call the AHEC, Area Health Education in Palm Beach, they have an 800 number. I have it if you want me to.
Yeah, read it out here.
It's 877-819-2357, and that's for the group class. But if you can or didn't or whatever, and you just show up in the class, we can
help you there.
Yes, and we can register you there.
So when and you've already said they're already at the building A at the county
building A. Yes.
Date and time?
It's every Thursday, 5:30 p.m. to 6:30 p.m. We do not keep the participants longer than that. Every week for 4 weeks, and then we have a second class. Is a 2-hour class just to kind of recap everything and send you off.
So no birthday candles, right? No smoke.
That's what they're asking for. Pizza at the time. Yes.
Okay, well,
to graduate.
And really, it's about satisfying your soul, right?
Sure. Yeah.
Food does that for a lot of us, and if you're giving up one thing, you want to reward yourself.
And we do encourage. It's a smoking cessation class, but in general, we like to the participant to adopt healthier habits, healthier eating. More physical activity, giving up smoking. So we encourage them to do that. And the book it just has a section of all the things that they can do instead of smoking.
And really, you know, I'm going to grab onto the walking because when you're a smoker, you don't want to admit that you're slightly out of breath after going 5 houses. Okay.
Exactly.
But the reality is you have diminished your lung capacity. Yeah. And as a supplement to that, patting yourself on the back, starting to walk more is really good.
Yeah.
I mean, it's sort of...
I even say walking in the pool, inside the pool. It's because it's just a lot of, with the water...
It makes it a lot easier.
Yes.
Yeah.
So
that's a great idea as our weather warms up.
Yes, exactly. And it's fun.
And I can't imagine that it's a boring class with you teaching
my goodness.
it, Tina.
Well, we try our best.
So do you have another class that is starting soon?
Yes. We're almost finishing the one that we have right now.
Okay.
But every Thursday, the next one is on the 15th. It's a 2-hour class. And in that class, they get another box of patches. Patches. In the 4-week class, they get the patches, the gum, or the lozenges. But in the 2-hour class, they just get the patches, but they are encouraged to call the fluoride line that they will send them that.
So if you're time limited and can't make that 4-week commitment of an hour per week on Thursday, then in between each of those starts, you have a 2-hour class.
We do.
That is just a one-time show up, get the material, listen to you, get the encouragement, and then you can do the rest online or
or call.
Okay.
Great thing about the quit line is that it's at 24/7. Like me, I used to get up in the middle of the night, 2 or 3 in the morning. That would have been my perfect time for that quit line to call me. Yeah. And they do.
No kidding. That is
so
wonderful.
I think that's pretty cool.
That's very cool. Yeah. And it's very cool that you're willing to do this, Tina.
Oh, yeah, I love it.
Clearly, and it will improve the health of our community, each and every member. So, ladies and gentlemen, if you know of someone who you've just tried to convince, have them call. There's lots of different programs, lots of different ways. Maybe the timing isn't right, but you won't know unless you try. So, again, thank you for being with us. And next week, we'll be back with another very interesting guest. And have a great day. Thank you.